Hello.
Hi, my name is Crystal. I'm going to be the nurse practitioner taking care of you today.
Okay.
Anything in particular bring you in today?
No.
Okay, wonderful. I'm performing hand hygiene for my safety and for yours. And I'd like to start out today with a head exam, okay?
Okay.
So the first thing I'm going to do is I'm going to take a step back and I'm going to be inspecting my patient's hair, looking for quantity, distribution, any texture, any pattern of loss, okay? There is some male pattern baldness noted, okay? Looking, there is no dandruff, okay, good. All right, next I'm going to start and at the same time looking at the scalp, inspecting for any scaliness, lumps, nevi, or other lesions of which none are present. And then I'm going to just palpate, shape, contour. There are no depressions, no lumps, no bumps. Any tenderness as I'm palpating?
No.
Okay, perfect. Taking a step back, I want to take note of my patient's facial expressions. Very symmetric. So looking for any masses, any edema, which none is present. Second thing I'm going to do is I'm going to look at the skin. I'm going to be observing its color, pigmentation, thickness and texture, any facial hair distribution. All of that is appropriate for gender and race. Moving on, we're going to move to an eye examination, okay? The first thing I'm going to do is a static finger wiggle test. So my hands are going to go behind you, okay? As soon as you see my fingers wiggling in your vision fields, let me know, okay?
Okay. Now. Now. Now.
Okay, great. Next, we're going to do a kinetic red test, okay? So what you're going to be looking for is the red, okay? So as soon as you see that, let me know.
Okay. Now. 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 Now.
Okay, excellent. Taking a step back, I'm going to be assessing the position and alignment of the eyes. Again, they are symmetrical and appropriate. I'm also going to be taking a look at the eyebrows and the eyelids, noting the width of the pupil fissures, any edema, any color that would be abnormal in the lids, and eyelashes are going in the appropriate directions. Okay, next I'm going to touch gently at your eyes. Okay, you can open this up for me. Okay. Looking for any excessive tearing or any swelling of which none is present. Eyes look to be well lubricated, not excessively dry. Okay. Now what I'd like you to do, I'm going to push down on your eyes. I'd like you to look up. Okay. Excellent. Can you look to this side? Excellent. This side and down. Perfect. So what I was looking for there, looking for just inspecting the color, looking for any nodules, looking at the vascular patterns of the eyes, all of which are appropriate, okay? At the same time, I was asking the patient to look down at each side. This gave me a good view of the sclera. The color is appropriate. Now, I'm going to be testing the cornea and lens for opacities. I'm going to do that with my light. I just want you to look straight ahead, okay? All right, so the irises were clearly marked and well defined. There was no crescent shadow in the eye, so I think we're safe to say no glaucoma. All right, take a good look at me, open your eyes, good. All right, so they're inspecting the size, shape, and symmetry of pupils. I'm gonna take a step closer, and I'm gonna call his pupils a 4 millimeter. Excellent. Next, I'm going to test your eye's reaction to light, okay? So I'm going to dim the lights in the room. And you'll see me shine the light from one eye and to the next and then back. All right, back here. Excellent. And the eyes were, there was pupillary constriction, okay? Now, I'm going to take this, I want you to follow it in as it goes closer to your nose, okay? This will be testing convergence. Come in. Perfect. All right. Last thing we're gonna do here is we're gonna test the extraocular eye movements, okay? So you're just gonna follow my pen light. We're gonna go through a couple different directions, okay? Follow with your eyes, with your head very still. Very good. Coming back to center. And extraocular eye movements are intact. I'm going to move on to an ear examination now. So the first thing I want to do is just visually inspect the ears. I'm looking for symmetry of size and shape, any deformities, any skin lesions of which none are present. Okay, next thing I'm going to do is I'm going to do a gentle tug test. Any tenderness as I'm doing this?
No.
I'm going to use my otoscope. I'm going to take a look into the patient's ears. Okay, please let me know if I'm hurting you as I do this. Okay. Pulling up on the back of the patient's ears. Excellent. And that tympanic membrane is a nice pearly gray. Coming to this side. Excellent. And both tympanic membranes are a nice pearly gray color. There was no excessive cerumen that was impeding my view. There were no foreign bodies, no redness of the skin. All right, next we're going to do a whisper test, okay? So I'm going to come behind you. I want you to let me know what letters, numbers I'm saying. I will be occluding one ear, so just listen for 3 letters, 3 numbers, and let me know what I'm saying.
Okay. A, B, C, 8, 9, 10. D, E, F, 5, 6, 7.
Perfect. You did very well on that. All right, now we're going to use a tuning fork here. So we're going to start with the Weber test. What I'm going to do is I'll strike this and I'll put it on top of your head. I want you to tell me if you hear the sounds evenly in both ears or if they sound louder or softer in one. Okay.
Okay. I guess the same in both.
Perfect. All right, and then we're going to move to do the Rhine test. All right, so this, I'm going to place it behind your ear against the bone. I'm sorry, it's a little cool. Okay, as soon as you stop hearing it when it's placed back here, I want you to let me know. I'm going to move it to the front. Let me know if you still hear it then, okay?
Okay. Okay, stop. Yes, I can still hear.
Okay, and we'll come to this side and do the same thing.
Okay, stop. Yes, I still hear.
All right. So from there, we're going to move on to a nose examination. First thing I'm going to do is ask the patient to look at me. I'm going to be looking at the nose for any asymmetry or deformity, of which I see none, okay? I'm going to obstruct one nostril. I want you to breathe in. Let me know if you can still breathe through that nostril. Perfect. All right. Next, I'm going to be assessing the nasal mucosa. So I'm going to ask my patient if he will look up to the sky for me. I'm going to use my light and just look right up there. Good. That nasal mucosa is a nice pink. Okay. And I do not see any drainage or anything of that nature, no swelling. Okay. I also did not notice in that any deviation or perforation. And I'll finish this. I'm going to palpate your sinuses. I want you to let me know if you feel any pain or pressure as I'm doing this, okay? Any pain?
No.
Any pressure?
No.
Okay. How about here?
No.
to move to a mouth and throat examination. Do you have any false teeth that are removable?
No.
Okay, excellent. I always want to check that with my patients. So here I'm going to put some gloves on. So the first thing I'm going to do, just relax your mouth. I'm going to be looking at the lips, looking at the oral mucosa. Okay, any pain or tenderness? Okay, I'm going to be inspecting the gums. I'm going to be lifting up. The gums look a nice, healthy pink. Perfect. There were no missing teeth noted, nothing misshapen or abnormally positioned. So the next thing I'm going to do, I'm going to use the tongue depressor in your mouth. When I put this in, I want you to give me a big ah.
Ah.
Good. And I do see the uvula remain midline, and the soft palate is rising. Okay. So I'm going to continue to assess the tongue. Okay, stick your tongue out for me. Moving it to one side. So there, the tongue was symmetrical, the color was appropriate. It did have nice papillae on the surface of it. There was no coating. Okay. Last thing I'm going to do is inspect the patient's pharynx. So if you will, I'm going to take this off. All right, give me a big ah. Moving that down. All right. Give me one big ah. Excellent. So there was no redness, no exudates, no ulcerations on the back of the throat. So we look good there. All right, moving on, we're going to do a neck examination. First thing I'm going to do is I'm going to take a step back. I'm going to be examining my patient's neck, looking for symmetry, any masses, any scars, none of which I see present. Don't see any enlargement, so that's good. Okay, the next thing I'm going to do is I'm going to be palpating through the patient's lymph nodes, so just bear with me. Okay, you're going to feel me touching, pre-auricular, any pain or tenderness?
No.
Okay, moving down to the parotid. Good. Coming into submandibular and submental. Any tenderness suppressing here?
No.
Okay, I'm going to anterior cervical. Any pain or tenderness?
No.
Okay, any posterior cervical pain or tenderness?
No.
Okay, going post-auricular. Any pain? Coming back to occipital. Any pain?
No.
And any pain or tenderness here?
No.
Okay, so that is a negative exam. There is no palpable lymph nodes, no pain or tenderness. Next thing I'm going to do is I'm going to look at my patient, and I'm going to be assessing for tracheal deviation. Trachea is in the midline. Okay, again, I'm going to palpate down. I'm going to gently displace if maybe a tiny bit painful. Okay, any discomfort there?
No.
Okay, perfect. Next thing I'll do is I will auscultate the trachea, and I'm hoping to hear tracheal breath sounds as I'm auscultating here. Okay, so I'm going to put my stethoscope on your neck, and I just want you to take some nice, good deep breaths. And again. Perfect. So tracheal breath sounds were present as we auscultated. All right. Next, I'm going to be inspecting the thyroid glands. I'm going to move this over here. And I want you to tip your head back just a little bit. For the male, I'm going to be looking at the Adam's apple to kind of give me a good idea of where this is. Okay. Seeing a lower shadow here. All right. Now what I'd like you to do is I'd like you to take a little bit of this water in your mouth. Okay. Hold it. Tilt your head back. And I'd like you to go ahead and swallow. All right, good. Okay, need another sip?
Nope, I'm good.
All right, and then I am going to Have the patient hold this as well. I'm going to come to the back. I'm going to palpate again for that thyroid. Okay, take a nice sip in. Hold that. Tip your head back and take a nice swallow. Excellent. Any pain or tenderness as I'm pushing?
No.
Okay, excellent. And did any part of that exam cause you any discomfort?
No.
Okay, perfect. Thank you for letting me examine your head, eye, ears, nose, throat, and neck today. We'll continue the examination in just a few moments.
All right, thank you.
Thank you.